May I invite Aarti to introduce our next speaker? Ranjit, can you put up the next?
Our next speaker is Dr. Neha Gill, physiotherapist, BPT, MPT, Ortho, and she is going to speak today on sudden sharp low back pains, how to manage, tips to manage. Dr. Neha Gill is participating in antenatal, postnatal, and women health for the last 10 years. Graduate from Punjabi University, Patiala, and PG from Gyan Sagar College of Physiotherapy, Banur, taking antenatal classes, postnatal sessions, and labor management in the Cloud9 Hospital, Chandigarh. I welcome you, Neha. Please start your session. Welcome you.
Thank you so much, ma'am. And good morning, everyone. And first of all, I thank you, everyone, for giving me this opportunity. And today I'm going to demonstrate you a few exercises which will help you in keeping your spine healthy, right? Now, talking about sudden low back pain, right? So it is one of the common reasons for which a person visits a doctor, right? And it can happen due to sudden twist and turn, or if you have lifted something heavy by mistake, or there is any sort of trauma, or if you have a sitting work profile, even that can lead to a sudden increase in your low back pain, right? And there are times when you actually know the reason, you know the history, why the pain is happening, and sometimes you doesn't even know why you are experiencing pain. So that is why it is very important that you need to keep your spine healthy, right? Now let's discuss about the tips, what you can do if you're experiencing pain in your back. Now, the first thing is to have a good rest for at least 2 to 3 days, and you need to avoid any activity that would put extra strain on your back muscles, right? Now, talking about rest, then the next question that comes in our mind that how we need to lie down to take rest. So, if you are experiencing back pain, then you need to lie down on your back and keeping a pillow, one pillow or two pillow under your knees. So that would actually put the pressure off from your back muscles, right? And the next thing that you can do is you can apply ice pack, and you need to apply it for a good amount for 15 to 20 minutes till that area get numb, and you can apply it for 3 to 4 times in a day, right? And then you need to work upon your posture, right? And any posture that increases your pain, that has to be avoided. Let's say if you're experiencing pain while bending your spine. So for initial days, you need to avoid that movement, and you need to lie down on your stomach with 2 to 3 pillows under your stomach, right? And then you need to keep yourself moving. Try to take a walk every day. Try to stretch your muscles so that your muscle length is always maintained, right? And another tip is to maintain a healthy weight, right? So these were the few tips which you can follow if you're experiencing a low back pain, right? And now we will learn few exercises which you can do to keep our spine healthy. So I'll be demonstrating 5 exercises. Now the first exercise is to strengthen up our abdominal muscle. For that, you need to come in lying position. Yes. So you need to lie down on your back. Then you need to extend your one leg out and keep the other leg bent, right? And then keep your hands under your waistline, and then you have to press your back in order to bring your spine into a neutral position. Press your back, and then you have to lift yourself up, and then slowly go down. Again, press your spine, and then lift yourself up and down. So this will help in strengthening up your abdominal muscles. Because when we talk about abdominal, the first exercise that comes in our mind is the partial pull-up. But this exercise is something which not everybody is able to do. So this is the simple way which you can practice. So all you need to have all you need to do is extend your one leg, bend the other leg, keep your hand under your waist, press your back and then lift yourself up. So it will be easy for you to perform this exercise, right? Now the next exercise is pelvic bridging exercise. For that, you need to bring your both legs in bend position, hands at your sides, and then gently lift up your pelvis to the point you feel comfortable, hold, and then slowly bring it down. Yes? So again, you have to lift your pelvis up, hold, tighten up your buttocks, and then slowly release it down. Let's do it one more time. Again, up, and then down. Yes? And then the next exercise is knee to chest. So the third exercise is knee to chest. Like its name suggests, so we have to bring our knee close towards our chest. Now, straighten up your legs, bend your one leg. Grab your leg from the thigh area and then bring it close towards your chest. Hold and then relax. So don't hold your leg from here and give a pressure because it will put extra strain on your knee area. So you always have to grab from the thigh and then stretch and relax. So this will stretch your glutes and your lower back muscle. Now we are going to repeat it on the other side. Now bend the other way, grab it from your thighs and then stretch, hold, and then relax. So always while holding, make sure that you are not holding your breath. So this is just the movement which we are holding. So once you get comfortable with this exercise, what you need to do is you need to bend your both legs, grab it from the thighs, and then lift it up. Again, hold, and then bring your one leg down, and then the other. Yes, again, you have to lift your leg up one by one, and you have to also release one by one. Yes, so this was the knee to chest exercise. Then the next exercise we'll be doing is in the all four position. So all four position is when you are putting the weight on your both hands and then your both knees. So this is the all four position, and in this we'll be doing a cat and camel exercise. This is a very good exercise for our spinal flexibility and plus for our core muscle training. So what you need to do is, you need to come in this position and then you have to round your back as if you're trying to look towards a navel. And then bring your spine to the neutral position and then you have to arch the loop up. Again, bring it to the neutral position. Then again you have to round to look towards your navel. Neutral, and then to look up. And then neutral. Then the fifth exercise is to hold your one leg out in the same position. Hold, and then slowly bring it down. Again, up and down. So this will help in strengthening up your hip muscles. Lift up and down. Again, up and down. Then you can add on with the arm movements. Then in the same position, we are going to lift up our one arm up and down. Again, up and down. Then on the other side and down.
again up and down. Now further to progress this exercise, what you can do is you can lift one arm and the alternate leg together. So lift. So this will activate your core muscles and then down. Then on the other side. Hold and down. And then relax. So these were the few exercises which are very easy to perform and can be performed by anyone, right? Because they doesn't put pressure on your back area and they help in the strengthening. And when we talk about strengthening of your back muscle, it's not always the back muscle which have to be strengthened up. So it is all about creating balance in your body. So we actually need to work upon our abdominal muscles. We need to have a good core muscle strength. And by core muscle, I doesn't mean that everyone should have a six-pack ab. So it's all about having a balance in your body so that your spine is healthy.
Yeah, thank you. Thank you, Neha. I think you did an amazing job. I have one clarification. At
Yes.
one point, when you were talking about suppose you bend forwards and you have pain, at
Yes.
that time you said that the way to lie down is on your stomach and
Yes.
keep one or two pillows under your stomach.
Yes, ma'am.
Is that
Because
correct?
that will maintain the arch of your spine.
But if you bend forwards and there is pain, so
It's
actually,
extreme movement, ma'am. The extreme movement that is putting the pressure, but we are releasing the pressure and we are keeping a support there.
I see. I understand now. So if you are bending forwards, avoid all those extreme movements, but you can
Yes.
give rest to your spine by
Yes.
correcting the curvature of the spine by
Yes.
keeping a pillow under your stomach when you lie on your stomach.
Yes, ma'am. By this actually mean that like a lot of people, what they do is they stop bending their spine. Like once they experience any sort of pain, they eliminate this movement from their life. So it is actually just for the 2-3 days of the acute pain when we have to avoid that movement. But otherwise, our spine is meant to bend forward and meant to be straight.
Yeah, I think you did a great job.
Thank you, ma'am.
Thank you, Neha. Shobha, you, Aarti, Shobha?
Yeah. Shall I say Aarti? Both the talks were amazing today, and I think it is becoming more and more evident that this program is very exclusive and a very need of the art session for an organization like Indian Menopause Society. And I am feeling a little sad that as of now this is the end of season 1, and I do hope to be part whenever it gets rejuvenated again. Well, about the physiotherapist today, I think you had, Neha, you had a great screen presence for demonstration of exercise. I really appreciate the way you have taken the camera shot, and it is very, very easy to make out all your movements. I appreciated that today.
Thank you so much.
Because we don't get that very often, that it is so correctly positioned. And you showed very well. I think we all, and they were very simple and doable. That is what was very appealing about it. And I think you gave good message on the back posture as well, and back movements. Nirja was able to elicit everything in 2 minutes time. So that is, thank you for joining us, Neha. And
Thank
all
you.
the very best for all your future work. I think you have great potential. With that, I would request Aarti to conclude this very finale. Yeah.
दोस्तों, आज ये हमारी प्रेरणा सीरीज का शायद आखिरी एपिसोड है। हम कोशिश करेंगे कि आपके पास हम प्रेरणा का सेशन 2 लेके आ पाए। मैं अभी आपसे कोई प्रॉमिस नहीं कर सकती, बट आई विल ट्राई माय बेस्ट कि हम इस प्रोग्राम को कंटिन्यू करें। और थोड़ी सी फॉर्म चेंज करके करें, बट वी वांट टू कंटिन्यू दिस प्रोग्राम. It will depend further the decision of our seniors, कि they will allow us or they will not allow us. But thank you so much for the whole year. Especially, I will like to thank Dr. Neerja, Dr. Shobha, who has done throughout the year tremendous work for continuing this program. I will like to thank Asna also. And overall, जितने भी हमारे contributors रहे हैं इस program के throughout the year, I will like to thank each and every member, including Mr. Ranjit Sahu, who has provided us this network to continue our programs on the Zoom. So thank you, Walter Bushnell, for giving us this
Thank you, ma'am.
opportunity to continue this program. Thank you so much. And आप दोनों में से कुछ ऐड करना चाहे तो you can add. Neerja.
Yeah,
I think we should leave the last word to Neerja.
Oh,
Yes. Yes.
not like that. I think, Shobha, you do a great job. So why don't you conclude it?
No, I think I did say Neerja. मैंने कहा तो अब आपकी बारी है. हम ये यंग असना से भी ले सकते हैं एक दो बात और फिर
Yeah, I think Asna
आप
can
उसको
close it now. We have several things in the chat. Can we just quickly have a look? I
Yes,
think it.
sure.
yeah, why not? Why not? Why not?
So let everybody.
Questions भी
all of-
हैं, एक दो questions भी हैं ना नीरजा जी?
Rashmi,
Rashmi Gupta and Rekha Tandon. Yeah.
please, can we take them?
There's just one question about the first exercise. It's a forward bending exercise. So will it not increase pain in lower back? That's a very kind of,
Yeah, I
valid
think
question.
I asked that question, and
You
what
already asked, and she
Neha
said that.
Yeah.
So yes,
Correct.
so actually this will help in strengthening of our abdominal muscle. So that would help in creating balance in your body, and it is not an extreme posture, right? So we are just activating our muscle. So that would increase the pain. But yes, of course, in the acute phase, we are not supposed to do this exercise. So this is just to keep our spine healthy.
Yeah.
Correct.
What
Rekha
another-
Tandon is,
There's another one also, Shobha?
yeah, Rekha Tandon, bending and touching feet and other bending exercises, are they safe? Actually, there is a concern in the mind of patients because if there is a disc prolapse, maybe then it becomes a risk. So how do you tackle that?
Yeah, it entirely depends what is actually the reason for the pain. Yes, of course, if it is your disc prolapse, definitely this exercise will be avoidable. But if you're not experiencing any pain, you are just working upon increasing your flexibility, then yes, of course, you can do this exercise. But always make sure that when you are doing any sort of extreme movement, don't hold your breath and then try to touch your toes. So just bend down to your comfort point, and eventually your strength or your flexibility is going to increase.
Yeah.
Definitely.
Anything that causes you acute pain, you should first consult your doctor and check out whether you have a disc prolapse, whether that prolapse is anteriorly or posteriorly. So you do need to check out, because there are many people with disc prolapse when they have an anterior shift of a vertebra or the disc, then they can do the forward bending very easily, but they cannot do the backward bends because that will increase that defect or whatever that problem is. But do consult your doctor. All these exercises go with a disclaimer that they can be used in acute emergencies. Whenever you have any problem, you can do these gentle things to unlock whatever has happened, but don't do anything if it increases your pain.
Correct.
So, Asna, I think,
Asna, I think you should close the session today.
yeah.
Thank you so much. So I think it was a wonderful session, and the whole Prerna series was a wonderful, amazing series. And there were the speakers. I mean, it is Neerja ma'am has really done a commendable job by bringing us so many wonderful people, and people whom we wouldn't have been able to. I mean, I
Exactly.
didn't know such people even existed. Some of them were so wonderful. And today also it was such an amazing talk by Suparna. And the best part is that all of these videos have been uploaded by Neerja ma'am on the Digital Education Committee YouTube channel. So we can always keep going back to them and, taking away whatever, getting the inspiration from them and getting motivated by them. So I love that part the most, because we can we can hear them in whenever we have the time and
Whenever
when
we have the time.
so that is the best part, I feel, and it will remain with us forever. I mean, it's on YouTube, so
Definitely.
you can always keep going back to it, right?
Correct.
So that is the best part. So I think it was a wonderful idea of Aarti ma'am that we could have this Prerna for this whole year. And thank you so much, Neerja ma'am, Aarti ma'am, Shobha ma'am, and also thank you, Walter Bushnell. And I think that
We
is
can-
all I have to say.
Thank
Yeah,
you,
we
ma'am.
can close now. I think Maninder
Yes.
is in the panelists, in the attendees. Would she like,
Yes.
because this is the final program?
Yes, yes.
Physical exercises have been really very, very good and very practical, doable, as Shobha said, that and all of us should be doing, at least when we are not doing anything. At least if we
Correct.
do these stretching exercises daily, that also helps us a lot. And about that, the first lecture on the how to forgive others and forgive ourselves, that is the way the positive thinking should go on for us. And especially in this age group, when we are coming, we have got so many people where we have to forget and forgive, including ourselves, for our past actions and everything. So that was also very good. Neerja, you were my one of the initial mentors, because it's your workshop from IMSCON, from where I had started my active participation in the Indian Menopause Society. I'll never forget my first lecture of prescription of exercise. So thank you, Neerja. These series have been really wonderful. Thank you, Aarti, for taking them forward. Indian Menopause Society for always being a family. And we should always, all of us should be bent upon this thing, but that we have to take it academically. It's a family matter, but it's an academic and nothing beyond academics. That is what we should be, because we should may see the rise of the Indian Menopause Society in an academic way, whether it's research or webinars or the CMEs, but they have to be academically research oriented and evidence based. Thank you very much for holding these wonderful webinars. And I don't think it's the end of it. The new team will also
Yeah.
continue with it. We'll see to
Yeah.
it that they continue with the good things.
Yeah.
Yeah.
आपका
Thank you.
influence चाहिए.
Yeah.
Thank you.
you.
Want to close. Walter Bushnell is also very much elated to be associated with such a beautiful program that is Prerna. 16 episodes were there all together. Thank you, Neerja ma'am. Thank you, Shobha ma'am. Thank you, Aarti ma'am. And thank you, Asna ma'am, for getting